live on YouTube. I'm just starting the streaming right now. As everyone knows, it takes a little bit of time to buffer. All right, Mayor, go ahead.
Thank you, Steve. Well, welcome everybody. This is our 14th episode of the Mayor's Breakfast. This morning, we are going to focus on schools, which will be opening come this fall, although it'll be not traditionally the way we've always been used to it. And that's one of the reasons we've invited our Superintendent of Schools, Rick Schmitt. Rick, thank you for being here. And our school board member, Ken Mintz. Thank you, Ken. The focus today will be on schools. Of course, we'll be starting, as we always do, with Candace Andersen, giving an update. And after the presentation by the schools, we are going to have, again, as a guest, Dr. Patrick Joseph. He'll be talking about, and I think focusing on information for parents who will be doing schooling at home, especially if they have groups of kids with at their home or in groups, and giving some tips. We look forward to hearing that. So, but I'll open up and turn it over to Steve for a moment to give updates on the city.
Great, thank you, Mayor. And I'll try to go through this really quickly because we do have a packed schedule today. But in terms of COVID-related items with the city, as everyone has probably already heard, the state recently ruled or provided new guidance for outdoor salons. So we're just anxiously waiting for the county's guidance on that item. And then the city is preparing for any kind of inspections or permits that would be related to that. Field use, a reminder that field use is, if you see sports groups out there, that should be people holding sports camps with the same group of people. We have had some reports of people from outside the area coming in and doing these kind of pop-up events, but we do have staff out there to respond to those. Also, one other COVID-related item, our counters are still open. We're seeing a lot of online appointments for permits, in particular with our permit center. So many people are now shifting over to online appointments. And two other non-COVID related items. First, the Preserve recently released 3 more affordable homes through the House Key program. So we're looking forward to those being awarded soon. And also the City Walk EIR continues to be reviewed, and it was reviewed this week at the Planning Commission. And with that, Mayor, that's my brief update.
Thank you, Steve, as always. We'd like to reintroduce, as we do every week, Candace Andersen, our county supervisor, who has been, I think these last 4 to 5 months have been a rather interesting time for leadership here in Contra, Costa County. And as always, Candace, we appreciate the long hours you're putting in for us. So what's new in the county this week?
Oh, I wish there was nothing new. And unfortunately, we continue to see our cases rise. You know, a month ago in the county, we were just over 2,500 cases. 2 weeks ago, when I was with everyone, we had leaped almost 2,000 more cases to 4,300 cases. Now we're at 6,425 cases. So the last 14 days, we've seen 2,068 new cases in Contra Costa County. Currently, we are averaging 163 new cases a day. 2 weeks ago, it was 146. And, you know, a month ago, we were down much lower. And so we are doing, like we all know, more testing. So of course you would expect us to find more positives, but we do continue to see the positivity rate of those cases in a higher level than we would like them to be. Now, right now, our positive rates for tests have gone down a little bit since when I was with you 2 weeks ago. Right now, we're at 6.3% as of the last few days of the cases we've tested have turned positive. 7.6 is where we were 2 weeks ago, but much higher than where we were a month ago, which was 3.9%. And as I've told you before, where the county gets concerned is anytime we're over 5%. That's just showing that there is a significant community spread, and that's why we're worried. When we did our attestation with the state, we said we would keep it below 8%, and of course, right now we're just a smidge below that. When I talked to you a couple of weeks ago in your city, you were at about 109 cases. you're now at 146. So in 2 weeks, you've had 37 new cases. A month ago, you were at 55 cases. So you've gone, almost 100 new cases just in the last month. The last 30 days, it's really been, close to 250% of increase. So significant increase. And I think it would be one thing if we were just saying more people are testing positive. Gee, that's too bad, because we know some people can weather this virus much, much better than others. Some are asymptomatic. We get that, but it's our hospitalizations. Right now, we are seeing significant increase still in hospitalization. So back in early June, again, a month and a half ago, almost 2 months ago, we were averaging 13 people in the hospital today. 2 weeks ago, we were averaging 54 people over a 7-day period. And now our 7-day average is 89 people in the hospital. Yesterday, we had 101 people hospitalized. When we compare this to where we were back in April, when we thought we were in a surge, our peaks were in the 40s. So still significant. Hit a very grim milestone this week of 102 deaths in our county. A month ago, we were just 44 deaths. And while again, 70% of the deaths are a result of those who are either living or working in a long-term care facility, there still are many, of course, in the general community. And it's not just, older people. Again, majority of those who are passing away are people who are in the older range over age 70. But we have had 20 people who have died who are in the 50 to 70-year-old age range. It's close to home to some of us who happen to be in that. We are still on the state's monitoring list, which does, of course, impact the school district's ability to open. We are on the state's monitoring list mainly because of the high positive case counts we have. They measure us on 100 per 100,000 population. They want us to be under that on a rolling 14-day average. Right now, our rolling 14-day average is 109.6 cases. But they also watch to see a 3-day 10% surge in hospitalizations. We've been so high, we haven't quite peaked at that, but they continue to cite that as one of the reasons that we are on the watch list or monitoring list. And so the key actions that they have requested we take to deal with this is really to delay, the opening of additional businesses, activities, encourage people to stay home and avoid gatherings, to continue to adhere to the state's guidance on face coverings and enforcement activities. They want us out there enforcing, and we will on Tuesday, the Board of Supervisors will be considering an urgency ordinance that would create an administrative fine. And we're not suggesting that cities should be out citing people for mask violations. This is really businesses who may not be operating appropriately, who are given educational warnings, but then choose not to comply. Just another vehicle rather than currently the health order is enforceable by law as a misdemeanor. And that's a much more complex jury trial other way. And this would be a much simpler way. And they want us to continue to work with the communities, community-based organizations to share messages about face coverings, other prevention techniques. And when you look at our county numbers, even though ours in the San Ramon Valley have increased significantly, Danville's even in the last 30 days increased over 300%. Southern western end is what I'm trying to say. San Pablo, Richmond, those ends of the county are faring much worse. And so thought I'd talk just briefly too, because long-term care facilities are such an issue. Currently we do have 15 active outbreaks in the county, and there's a dashboard on the website talking about this, 10 that have been resolved. So we've had a total of 25 long-term care facility outbreaks. When there is an outbreak, county health or one of our healthcare partners, which would be San Ramon Regional, John Muir, Kaiser, sent a strike team in to review the infection control practices with facility and staff. Mobile testing unit then goes into nursing homes. They do the on-site testing. Of course, testing is being done even before there's an outbreak. And so regular testing, monthly testing is taking place. And so we do have both county health and our healthcare partners doing this surveillance testing, both at skilled nursing and living facilities, and just testing those who are asymptomatic as well. So right now, and as everyone knows, it looks like we're going to be looking at distance learning because we still are on the state's watch list. And so what we're hoping is there's been such great cooperation with county health, with the county office of education, and with individual school districts that we're really hopeful that we can in fact find opportunities to improve, to respond quickly as there might be changes in the data. As has been mentioned before, and people may have read in the media, waivers are available for elementary schools to hold in-person classes. And so the state is allowing local schools to ask county health departments for permission to have in-person classes in counties on the state monitoring list. And the requests have to be made by the superintendent to the health officer. The local health jurisdiction then reviews the data and consults with the state. So it's not just us, the county health, deciding that, but in conferring with the state. And then both the state and the local health jurisdiction have to sign off any waiver granted. Big question that's come up lately is why is it taking so long for some of our COVID-19 tests to get the results? And one, we are prioritizing a little bit more who is going to be tested based on the fact that we are running a little bit in short supply of tests or the reagents you need to process the tests. And so big, heavy demand across the country. We're finding within our county labs, we're able to turn things over most of the time within 48 hours, which is where we usually send first responders or those who have a critical reason why they need to know, such as healthcare providers, if they have it. Our commercial labs, where most of the tests are sent when you do one of our drive-ups, they can take 10 days, 14 days. I actually did a test a few weeks ago at San Ramon. It took 13 days to get my test results. And again, I was not feeling symptoms that had been in around people and thought it was a good time to do a test. And in fact, fortunately, I do not have COVID. Contact tracing continues to improve. And we know this is critical, and it's very, very challenging when we don't get our test results back soon enough. And so we are looking at other ways and other labs that we might use. And there are some rapid tests that seem to have a little bit more consistency. We're waiting for FDA approval of some of these rapid tests, but we would like to see those because it does impair our contact tracing. Right now, as of yesterday, we had 135 people who were employed as contact tracers. And we also have another 30 tracers that the state has provided us that are working with us. And right now they feel like they are hitting about 90% of all contacts that are provided. So we're doing well, but it's a complex area, and it's something though that is critical to us containing the virus. And so we are looking forward to seeing what's going to happen next. At this point, there are no openings on the horizon. We don't have a new timeline simply because we need to get a better handle on where we are and start seeing not just declining, but even a flattening of our increased rates in both the number of cases as well as the hospitalizations. And tragically, what follows, of course, deaths. So that's my report today.
You'll be able to stay and answer questions at the end, correct?
I will stay and answer questions at the end, indeed.
Yeah, good, thank you. Because as a reminder, if you folks would like to ask questions, the email address is info@sanramon.ca.gov. We do have a number of questions already that Steve is collecting, but please feel free to continue to send them in. Thank you. I'd like to introduce our superintendent of schools and our school board member, Ken Mintz. Our superintendent of schools is Rick Schmitt. Rick, I'd like to do the introduction by expressing the views of all of us here in the community. We appreciate the hard work and the tremendous stresses and pressures that all administrators, all employees are going through as they try to resolve what is the best way to educate our young children. And there are tremendous pressures from both sides of the aisle coming at you guys. I just want to let you know that we in the community appreciate everything you do every day, including all of the employees, all the administrators and the teachers, and the time you all spend, including you, Ken, and the entire school board, trying to approach us in a very thoughtful way. And there are people on both sides who have, I think, good faith disagreements. But at the end of the day, I really want to thank you for everything that you guys do to try to open up the schools as safely as we can. So with that introduction, Rick, what can you tell us about what's going to happen this fall?
don't know if I can predict the future, but I can kind of help you understand best kind of where we are today. Thank you, Mayor Clarkson, for everything you do. Back at you and your team, your elected officials and all. Great to see the panel. Candace, thank you for an informative setup. I think that helps provide context for a lot of what I'm going to say. So I'll be brief, and then I think the real value added here will be answering some questions from the San Ramon community. So as I believe most are aware, our trustees took action last Thursday evening on my recommendation to shift in-person school opening on August 11th to a full remote. The criteria really was all set up around the facts that Candace really provided in her introduction earlier here a few minutes ago, but also what I was aware of, and many know that on Tuesday night, our trustees last week, so 10 days ago, took action to open in person. And literally 48 hours later, we changed that. And we became aware early Wednesday, even before the governor went public on Friday, what the governor was going to do in terms of his directives around the counties on the watch and monitor list. So we had an indication that was coming, and in fact, it did 24 hours later. What I have tried to frame from the beginning, whether it's talking to parents or teenagers, elected officials, our staff, is each of us gets to define two things personally, our own way. And there's no right way. One is what's best for kids, and we have different opinions on that. Some believe best for kids is to be in school 5 days full time with no masks. Some believe their kids are most safe in their own home and not leaving their home, with lots in between. So what's best for kids is there's no right answer. Number two, how to weigh risk. That is our own decision. Each family gets to determine that. Our trustees, our school district leaders are looking on best and fair ways to weigh risk. The governor now has mandated what that looks like for school reopening based on the information that's very public now. Supervisor Andersen touched on it. We are not in a place, based on my last public health meeting, and Candace, feel free to give a secondhand compliment to your health department. They've been spectacular, readily accessible and available. And we meet with them every week and have had 17 lengthy meetings with public health going back to March with all of the county school superintendents. So what really got us ultimately to the full reopening, other than the governor's directive, is the impact on public health being able to manage all the flow of information, the contact tracing that Supervisor Andersen mentioned, the testing backlog. Just earlier this week and last week as well, there were outbreaks in school-sponsored summer activities in different places in the county where none of the workflow worked, where testing couldn't get done and or the results couldn't come back in a timely way. Contact tracing was challenged, and ultimately investigating these cases is nearly impossible as they've increased significantly based on the information Supervisor Andersen provided. So where we are now is the governor's office is still fine-tuning his directive on how schools reopen, working closely with all 58 county public health departments. And where it stands now is it's a rigorous process to be eligible to create a waiver to bring students back in person, and it's elementary only, and it's not absolutely clear what those criteria will be, and they're ever changing just based on the information provided last Friday. We'll get more information early next week from our public health departments. Finally, what I'd like to say is, and our trustees took action last Thursday evening, we want to get back in person as soon as it's safe and as soon as the public health directives, whatever they are and how they may change, allow us to do that. Right now, it's tied to the watch list or monitor list that Supervisor Andersen described so simply, but it's not simple. It's complex. So with that, again, this is a great community that solves problems together. It's personal, it's challenging, but again, we will get there And just to assure our community, the superintendent who will take over on August 1, John Malloy, has been regularly engaged in every single one of these conversations. In fact, I have had 2 meetings with him already this morning, and he's fully up to speed on all the things that I've introduced here today. So again, thanks team, special thanks to you, Mayor Clarkson, for all that you do over and above.
Thank you, Rick. And I'd like to now introduce Ken Mintz. Ken has been on the school board twice. I think you've served about 16 years on the school board. 18 years, yes. Your perspective as a school board member as to what's going on.
Yeah, thanks, Bill. First, I'm trying not to repeat anything of what Rick has already talked about, so I'll make my comments pretty short. But it's clear that this is something that we're all in together, or need to be. Rick mentioned our 2 meetings last week on the 12th and the 14th, and how things changed, or 14th and 16th, the way things changed from one meeting to the next over 48 hours. If you go back to our previous meeting on June 23rd, when we were first really addressing, a sense of direction, at that point in time, given the statistics that we were looking at and the risk factors, we were actually directing staff to look at 5-day-a-week opening. Going back full-time, as well as having a full-time distance learning option for families who either wanted or needed that type of opportunity. Things changed by the 14th, and we're looking more at the hybrid approach, which we had asked staff to continue to consider, but the situation had changed significantly. And then again, just as Rick said, 2 days later, given everything that we were seeing with county health and around the state, it made sense for us to consider yet another direction, which was to start everyone off on a distance learning platform. It really is about safety, and it is about risk factors. And I appreciate that there's many people that have very, very strong feelings on all sides of this issue. School board members have received literally hundreds and hundreds of emails in the last couple of weeks. And it's clearly not one view. It's across the board. And there are very, very significant impacts on families, on teachers, in terms of, people wanting to get back to work and being concerned about issues like childcare, but also being concerned about their children's health and safety, as well as the health and safety of family members, grandparents who might live with the family, and others that even if young children might not be as susceptible to strong impacts from it, they might be carriers. And there's still a lot of work, I understand, that's being done to evaluate across the world on the impacts of young people. If you think back just a few weeks ago, we weren't even hearing about millennial types being very impacted by this until the beaches started opening up and bars started opening up and other places where young people congregate. And all of a sudden we saw some spikes in those age brackets as well. We know that we're putting people in a very difficult position with the direction we're taking. There's absolutely no question, but we have to look out for everyone's best interest. And as much as I know we've been hearing from families about their concern about their kids being at home, working from home, not sure about, are their kids going to receive the same quality education if they're at home? We also need to take into account what happens when and if someone picked up the virus at school, that it affected multiple students, it affected multiple teachers, it affected multiple families. That's something that, given the statistics that we have at hand right now, we don't want to go there at the moment. I think one positive aspect of us starting with distance learning is that allows our staff to really double down on the quality of that education. From the springtime opportunity, unfortunately, that we experienced in March and April and May, we had mixed results. We had some teachers that were phenomenal. And we received communication from families and students about having very, very positive results from their distance learning experience in the springtime. However, that wasn't across the board. We had a lot of our faculty that really were doing distance learning for the first time, trying to basically build the airplane when it was in flight. And they did a tremendous job in trying to keep things together and work with our kids and our families. You know, what this opportunity right now is, if you were to look at it from a positive perspective, it gives us a chance to make sure that our distance learning is as quality as can be, with professional development of our staffs, creating more consistency and structure to our programs, adding assessments to our classes, you know, just being very clear about assignments, and also teacher interaction online, which was one of the things that we were hearing some questions about. So there's a number of issues that to do right now, as we start in August with distance learning, we will be in a better position, not only to move towards the transition of in school when the health experts allow us to move in that direction, but also in the event that there is a later surge and we find ourselves having to move back into a lockdown situation, we will be even that much more prepared for everyone to be able to take that step and feel comfortable. I think it really comes down to trust and confidence. Right now, quite frankly, there isn't a lot of trust in the testing system. As Candace mentioned, you know, if it's taking 10 days or 2 weeks to get a result back, someone who might show up as negative in that test result because they were negative at the time may very well have gone out in public and are now positive and not even knowing it, because the test result they received from that first test is giving a different indication. Again, maybe they're asymptomatic, but that doesn't stop them from possibly providing that to somebody else. So the trust factor in being able to get to you know, better testing and results of testing quickly is going to be critical. But the other thing is, for our parents and our families, trust and confidence in us as your school system, that we will provide the best possible education in distance learning environment that can possibly be done, and that we will be able to transition as soon as we can do so safely to in-classroom opportunities. So Bill, I'll stop it there and look forward to questions that might come in.
Thank you, Ken. I'd like to now turn to Dr. Joseph. And I want to again express my appreciation for your willingness to be here nearly every Friday morning and to help navigate us through the do's and the don'ts of dealing with COVID. So, Dr. Joseph, what do you have for us today?
Well, thank you, as always, Mr. Mayor. I appreciate the invitation and the opportunity to discuss the medicine side of so many topics. I'm going to share the screen, if you can help me do that, Steve. And there we are. So this is what we're going to try to address today. A few comments about COVID in our county, some comments about this disease in children, which is really a different disease, and maybe some of the thoughts as to why it's different. And then I've picked a few things to discuss from the medicine side about reopening schools and summer camps. So we'll start with COVID in Contra Costa County. And off to the right is the graph. And the graph really says it all. Supervisor Andersen has mentioned it many times. That steep part of the graph is what everyone is concerned about. That's what we don't want to see. That's the spike. That's where you talk about leveling the curve, flattening the curve, wanting to see the curve go down. This is the number of cases reported by day, or the number of new cases. So I put some things on the left that are maybe related to this. At least I can give you my opinions. That 4 months ago, we had a stay-at-home order, and that lasted for about 2 months. A month after that, there were face coverings recommended. And on May 18th, we began to reopen some retail and commercial places. Now, if you take out that COVID fatigue line, I think there's been too much emphasis saying that the spike or the increase in the number of cases was related to reopening. In actual fact, it probably is not. reopening was very well structured. And when I go to retail places, I find that is where people are doing exactly what they should be doing. It's rather well policed, or at least it's emphasized. I think our problem now that occurred through May, June, and even now is COVID fatigue. The big three still work: face covering, distancing, wash your hands. Those are the big three: face covering, distancing, and wash your hands. And we are seeing a tremendous amount of people who are saying, I've had enough of this. I want to socialize. I want to go out to dinner with my friends. I want to have people over. My kids need to play. And I understand all of that. I'm not at all critical of it, but rather saying that I think that is what we are seeing as the change in the curve. The virus is relentless. The virus will take an advantage of any time we let down our guard. And that's why Supervisor Andersen and so many others are saying, come on, come back. We've got to go back to the basics. Masks prevent spread. Hand washing prevents disease. Distancing prevents spread. And that has to go back to normal. And yet I think so many people have just had enough of this that they're letting down their guard. So what we need to do is to continue to emphasize that for ourselves, our households, and our friends. So now we'll go on to children. COVID in children is a different disease, but it is very poorly reported, and it is not uniform throughout all 50 states. So there is an estimate that about 185,000 children have been infected in the United States, but children is not defined. So in some states, the COVID disease is reported by age. Others, it's reported by age groups, such as 0 to 1, 6 to 10, 10 to 20, but it is not uniform. So it's very difficult to come up with some good information that, like we do with elderly, like we do with seasoned adults. What we do know is that they have an entirely different disease for the most part. The symptoms they have really look like a cold. They look like a viral disease that any child might get at school, at the playground, or around the house. Fever and a runny nose may be all they get, or a cough and a runny nose, or any of those may be all that is seen. It's definitely a milder disease than one sees in adults. And that translates scientifically to a couple of things that are probably important. Their disease is milder because they don't seem to get the viral replication that adults do. I have no reason for that, but it's factual. They have lower amounts of virus and they shed lower amounts of virus. And so it is assumed that they are less contagious than an adult with a high fever. In fact, the sickest person, the person in the ICU, the person in the hospital, or the sickest adult at home is the most contagious. Those who have the mildest disease are the least contagious. They are shedding smaller amounts of virus. Now, why they have this immune response that is weaker than adults is unknown, but it does translate to not as many antibodies. So children don't produce antibodies as well as adults. And the concern there is not that the amount of antibodies, that's just a laboratory result, but will they have a shortened immunity? So the sickest people produce the most antibodies and they stay the longest. Those who are least sick may have a shortened immunity and they may not be immune for as long as others. This is all work in progress, but it's very suspicious that children may be more susceptible than adults for a second infection. And any discussion of children would not be satisfactory without mentioning the multi-system inflammatory syndrome. This is very similar to Kawasaki's disease. There have been several hundred cases in the United States. This is the main reason we don't want a child to get COVID, because the multi-system inflammatory syndrome is a life-threatening disease and also a life-altering disease. As you can see, 80% of them end up in the ICU. And when they get out of the hospital, long-term consequences are common. So the multi-system inflammatory syndrome is the main reason that we want to protect our children from getting this disease. Now, there's some nice numbers on here, and I show this because it's very difficult to describe this, but this is what we know from modeling. And I put the age groups over on the left. Infants, we will call less than 1. Then there's the 1 to 5, 6 to 10, and those who are over 10. Let's take it from the top. Generally, an individual who is over the age of 10 years acts just like an adult. There's really very little difference in the disease, the symptoms, the immunity, the complications between 10 and 40. And the mortality rate between 10 and 40 is very low. It's 0.2%. On the other hand, on the top line, infants get a very, very severe disease. Less than 1, it is critical. And you can see that 1 in 10 infants who gets this disease is going to be in the hospital. They get severe or critical disease, and even a relatively reasonably high death rate. Mortality is unknown, again, because we don't have good information. This is all modeling. Now, the middle 2 lines are probably what we're concerned with in schools, and we want to try to address that mostly today. What we know is that you can see the percentages there. As an individual gets older, the likelihood of critical disease goes down. The death rate is the same for all of them, but it's estimated. But look how low that death rate is. It is a fraction of a percent. And that's why you hear in conversational languages, well, kids do just fine. And in general, they do. They have a very, very low rate of getting a critical illness, a very low mortality, a lower likelihood of spreading disease. And therefore, there are these concerns about, the lack of concern for children compared to elderly adults. So this, unfortunately, is all modeling because we don't really have good numbers yet, but this is probably pretty reliable. Now, Mr. Mayor asked me to discuss a little bit about schools and camps, and this is the way that I look at it. Before a decision is made, it requires input from several disciplines. Educational professionals like Mr. Schmitt and Mr. Mintz and many, many others, certainly parents, elected officials are very importantly involved, like you, Mr. Mayor, and all the way up to the governor. Input from the health department goes without saying, but then school nurses need to be involved because they're going to be on the front lines now. It's not going to be the first responders, it's going to be the school nurses. And obviously the sociology or the socialization of children and the psychology is very important. And this slide gives me an opportunity to say, I play just one little part. I can talk about the medicine, but nothing else above it. I can tell you what we know from the science side of this, and then I defer the others, the input from all of the others to specialists in those fields. And so we'll talk a little bit about the medicine side and what we have learned from my discipline. The common language on the street is, well, we should reopen the schools. They've had no problems in Denmark or Austria. And then the other side of the coin is, no, they had terrible results when it was done in the United States, in Missouri and Texas. And Israel was catastrophic, and they had kids and deaths, and it was spread to the families. And so we try to see what's different about those who had a favorable response to reopening schools and those who had an unfavorable response. And it would appear that the determining factor is in that right column. That is the background rate of activity of COVID in the community. So you can see at the bottom, Denmark and Austria had very few new cases per day per 1 million population. And that means that the background activity in the community of COVID disease was very low. On the other hand, Israel, Missouri, and Texas had a lot of new cases ongoing in the community Missouri and Texas opened summer camps and had horrific outbreaks. Israel opened schools and had a terrible result, but you can see what's going on in the communities where they elected to do so. So right now, this is probably not the only important information, but it's the only information that we have. And it looks like it is somewhat of a determining factor. So I'm going to show a next slide and input California and Contra Costa County in comparison to these. And they'll be on top in blue. So we look at Israel, Missouri, and Texas, and they're in the 200 to 300. Denmark and Austria are way below 20. And this is where we are in California. The state of California has about 226 new cases per day per 1 million population. And Contra Costa County is somewhere around 130, but with the numbers that, now this is per million, not new cases, but new cases per million. But Contra Costa County is pretty close to a population of 1 million. I think it's about 1.3. So when Supervisor Andersen said today that we have 160 new cases, that number of new cases per day for Contra Costa may be even higher than 130. And this creates concern. This is the only numbers that we have to look at. And we can see why everyone we're not flying through this like Denmark and Austria. Now, let's talk about this though in a different way. If we're going to talk about California, you can see the numbers very high. If we talk about Contra Costa County, it's much lower. And then there may be smaller communities where the number is even lower, or as implied by Supervisor Andersen, there's other communities within Contra Costa County that are extremely high in the southwest part. So this may be more of a microcosm or a micro community issue than it is by lumping it. This could be a case where splitting is better than lumping. So to address that in a different way, and I didn't put down all of the medical considerations, but I put down some selected things to discuss. The background risk is the community incidence, and incidence is a scientific term for the number of new cases. So the number of new cases per day. Now, if we're talking about a traditional school where kids may come to school from all over the county, then the county becomes the background risk. If it turns out that we're going to do micro schools or mini schools, which by the way are terms I'd never heard before the COVID epidemic, but if we're going to have groups of kids, of 5 kids or of 10 kids, and it is a bubble, it is a defined area, that may be safe if we know the incidence in that defined area, in that defined family set. So it looks like from the medicine side, not an educational side, not society, not psychology, but from the medicine side, the community incidence or the location or the micro community incidence is going to be a very important consideration. The next thing, and I've said this before, is the consequence. There's the risk, and then there's the consequence of somebody getting infected. And that is very individual. So if we're talking about a family where both parents are under 40 and the kids are healthy and they don't travel out of the house and their family unit is very confined, well, the consequence of an infection in that family would be low. But if in that house, one of the parents is getting cancer chemotherapy, or there's grandparents or someone in the house who's very elderly, or even the student, if the student is immunocompromised or the student has to take immunosuppressive medications, then the consequence of an infection is very important. So the background risk and then the consequence are the two big issues. And I've said that before. And that's for anything, by the way. No matter what, the biggest question I get is this safe? And this could be anything. Is it safe to ride on an airplane? Is it safe to ride on BART? And those are the two concerns. What is the risk and what is the consequence if you get infected? And then I put down some things that really apply to schools and even mini schools. And these are policies that we do not have, but must be considered if we're going to go this way. Now, I'm giving you the medical opinion, and these policies need to be written in advance. And I'll go over some of these, but what you can see is it's not just throwing a switch. Well, let's open the schools. This is a new ball game. We really need to be prepared for things that we've never had to look at before, even if we're talking about 5 students being in one house. The first, are we going to screen and test students and teachers? Is screening going to be done just by checking the temperature when they come in, or are we going to require a questionnaire? And are we going to test everybody? And if we test everybody, are we going to test everybody regularly? And let me digress for just a moment on testing. I couldn't agree more with the comments about testing. It is totally unsatisfactory to wait 14 days for a test result. The 2 biggest laboratories in the United States are Quest and LabCorp. And yesterday, the LabCorp commented to me that it is absolutely impossible for us to ramp up testing to meet demand. There are not enough people, not enough reagents. We're working 24 hours a day. And the reason is that the demand for testing has exceeded the capacity. But testing is going to be important. And I will say one other thing on testing. One of the exciting things that I did on Monday is a saliva test. It turns out that if you can create about 5 milliliters of saliva, so that'd be a teaspoon, that there's about 10 times the amount of virus because of the volume, then you can collect on a little flocculated swab. So a flocculated swab that we do, this is what has been known as a brain biopsy, or where you put the swab deep in the nose. It can only capture so many epithelial cells and so much mucus. But saliva, because there's almost no limit in the volume, has much more virus in it. And if that test becomes widely available, it can be done very quickly. And that's something that is much more applicable to doing on a regular basis for children, students, teachers, whatever. So that has to be addressed. Training of what the children should do, not just the teachers, but infection control training. And I'm always impressed at how well students learn, but they do have to learn practices that they've never had to do before. Keep their hands away from their face. Wash their hands frequently. Pay attention to what they touch. Be very concerned about their other students, their classmates, because they can spread the virus if they have no symptoms. Face covers is we've discussed it many times. I put as applicable because in schools, it's going to be a whole different situation. And I will defer that to others. That is, we know we don't put them on children under the age of 2, but whether face covers are even going to be possible at all in children in school on K through 8 is something I would have to defer. I can tell you how they work. I can tell you what they will do, but I can't tell you if they can be done. Distancing and playing. So there's some new information on this. So in children, the answer may be 3 feet instead of 6 feet because they shed less virus. Now, I have a question mark there because this is still being explored very, very carefully, but it may 6 feet for adults, because if I am infected with this virus, even if I have no symptoms, I'm going to be shedding a lot more virus than a student. So it's possible that we have an opportunity to cut down the distancing in schools to 3 feet. Environmental cleaning and disinfecting. This is new. We will need written policies, or I should say, I would suggest written policies, because it's going to be a different kind of cleaning and disinfection than the usual janitorial services. Hand washing and hand sanitizing goes without saying. There's going to be a need for hand sanitizers at all touch points, at all doorways. High touch surfaces such as keyboards, desks, bathrooms will have to be disinfected on a regular basis, or some form of way that they will not become contaminated. And that might be tissue papers at the doorway so you don't touch a doorknob with your hands. Outdoor versus indoor. I mean, if we can do outdoor, it is a gift. Spreading this virus outdoors is so difficult compared to indoors. Outdoor air currents take this virus away. Indoor, there are very few air currents unless they are mechanically created, which is what is being worked on in a lot of places now. But if teaching can be done outdoors versus indoors, the safety factor is huge. Engineering controls it's a way of protecting things. It's a buzzword that is used in medicine and in infection prevention. And what it means is creating doorways, desks, handles, knobs, things that are safer and less likely to spread infection. And I defer those to individuals who are specialists in that. But you know, when you can do this with an engineering control, you don't need to rely on personal habits. And the last one, it's last for a reason. This is going to happen. What are we going to do if a student is positive, or if a teacher is positive, or if a student is exposed? What do you do if you're in class and a student comes to class and says, my dad is in the hospital with COVID? These are very, very tricky situations, and it will happen unless that curve drops off quickly. All of these are real considerations. So there's a lot to it. I am happy to discuss the medicine side. And I've said this many times, I make recommendations, other people make decisions, but I can see that this decision is a very, very tough one to make. And I just have all the respect for all of you and all of the other disciplines that are involved. My role in this is easy, but making the decision is tough. Mr. Mayor, once again, thank you very much. And that's all I was going to discuss for now.
Great, thank you. I know that Rick's got a commitment at 10, so if we have some questions in the next few minutes that we can direct towards our superintendent. Steve, do we have anything for Rick?
Sure, and as always, Mayor, info@sanramon.ca.gov for submitting the questions. And I appreciate all the questions, and I'm doing my best to kind of condense similar questions together, in particular when there's lots of narrative to the question, trying to find out what the meat of it is. So if your particular question isn't asked, please understand that we're short for time. So one of the questions related to schools is, how long must we remain in remote learning before we start the process of returning all students to campus? And also, what are the plans for transitioning back to in-person education?
That is the question. Two really good questions related. Thank you, Steve. Great update. Thank you, Dr. Joseph. And I do have answers to some of your questions as best I can at the moment. As all of you know, these things change fairly quickly and regularly. In regards to our planning, we've been planning for in-person learning and returning to it since March. Our trustees gave me clear direction last Thursday night when they took action to open fully remote for the reasons I mentioned in my introduction earlier this morning. We are planning for and actually have adopted some strategies and some bell schedules for a hybrid return, which likely will be the way that we return to in-person learning. I don't see a clear pathway to leaving remote learning and automatically and quickly jumping back into 5 days a week, full-time, 30, 35, 40 kids in a class. That seems very unlikely locally or anywhere in California. So we have plans both in terms of bell schedule, in terms of health and safety, in terms of following all the regulations. The board's action last Thursday gave me and our new superintendent clear direction. As soon as it's safe, as soon as the public health direction allows for in-person learning, we will get to that quickly. We have continued to plan for the health and well-being of students, community members, and staff in order to, and when and if we are able to get back in person, how to do that. So the definition, as I mentioned in my opening remarks last Thursday evening in our board meeting, and again this morning, and a dozen plus times just since last week with different community groups. There is no one answer to define safe. Each community, each family gets to determine that on their own. There's no simple and direct response to that. We are all weighing risk differently. And as you heard from Supervisor Andersen just this morning, the numbers have gotten worse since my Monday public update with the public health officers and all of that. The governor is, as we speak, revising reopening. Not exactly sure what that will look like. He has mentioned he will have another press conference next week to determine, maybe on a statewide level, which he indicated earlier he didn't want to do. Well, he also indicated he wasn't going to give a direction on how to reopen schools, and he did that last Friday. So again, I have as many questions of all of you, but as of right now, I just want to reassure our listeners on this breakfast that we are planning for reopening, likely to be more of a hybrid approach where it's some remote learning and some in-person learning.
Great. Another question. What happens if students don't attend virtual classes? And also, how are you tracking employee attendance in the virtual classes?
So two good questions, both related. What is different for those parents who are familiar with the remote learning phase this past spring, both the laws and our trustees' expectation, our employee groups' learning curve have all pushed us to a place where the instruction, the remote instruction, in whatever shape it takes, whether it's full-time, like it will be beginning on the first day of school this fall, through any kind of hybrid and full-time phases back and forth through the school year, is there are statutes which require students to roll be taken. It was voluntary in the spring. There will be set schedules where each time, each day, there's a period of time. Middle school and high school, you'll have period 1 at this time, period 2 at this time, period 3 at this time. That wasn't the case in the spring. There are also strict requirements in terms of instructional minutes each day, each week. And so those are things that were not in place in the spring. And in regards to our staff, unlike a traditional beginning of the school year when teachers and instructional assistants and clerical support and media support and the 4,000 plus employees in the school district would show up to work every day, it's different. So the expectation is unchanged. Folks will show up to work, quote unquote, in different ways. Some have been working in person going all the way back to March. Others have been working remotely. And as any organization does, we pay attention to attendance. And I'm proud to say that our employees are following all of our guidelines and expectations and showing up to work, whether it's virtually or in person.
Great. And a follow-up question to that, and you somewhat addressed that. So in terms of support staff and admin personnel, are they still employed? Are they still able to do their jobs remotely?
It depends on the classification. We have expectations without getting into the 200 plus job classifications that we have in our organization. Some are in person, some are a blend of in person and remote, depending on their job requirements and job descriptions. And for example, our teachers and our counselors and other folks are working remotely as we speak, and will continue to work remotely, at least initially in August.
Okay. So, Mayor, you're on mute.
Rick, I know you probably have to take off here. I want to be time sensitive to you, so I so appreciate you taking time. And it's been an absolute pleasure. Your tenure here as our superintendent of schools, and wish you the best of luck as you retire and enjoy that new phase in your life.
Thank you, Bill. Back at you, and thanks team on the call today. What a great team. And one of the things I said 4 years ago as I arrived and saying as I'm kind of moving on to the next phase of my life, this is an amazing community that believes in schools, that believes in each other, the partnerships with law enforcement and public health, in our parks, in our city, in our town, in our county. It's unprecedented. And I've worked for a number of communities over my 40-year career. It's incredible here. People care. And even through these tough times, we will get there. So thank you.
Thank you, Rick. We have any questions for our other guests, Steve?
Sure, yes. One for Supervisor Andersen. When Contra Costa County is off the governor's watch list, will you allow personal services and businesses to reopen like other California counties?
And that's the hope. And we hope that once we're off the watch list, which will only happen when we have these stabilized numbers and start declining, we hope to go back to the timeline that we had in place that we very abruptly stopped on June 29th. I will add that, because you mentioned it earlier, Steve, as far as hair salons, from the county's perspective, because we did not shut the hair salons, the state did, they are allowed to reopen outdoors following the state guidelines. And so we will not be creating new guidelines. There are new guidelines by the state on the state's website. And there's simple things, with outdoors, you can only cut, you can't color, you're not supposed to shampoo, things like that. So on the state website, but hair salons from the county's perspective are ready to open.
I'm looking forward to getting a haircut again at some point. Another question, and putting several questions together, is there any consideration for separating out the statistics from long-term care facilities and prisons with the rest of the data? Because there's a perception that that data is affecting our schools reopening and other reopenings where it seems like they're more confined cases.
No, and we've had that discussion as well, just as we've discussed, should you segregate out certain parts of the county where case counts seem to be low? The reality is the people in long-term care facilities are getting the disease from somewhere. It's not spontaneously erupting in a long-term care facility. And so whether it's healthcare workers coming in who are being infected in the community, it is still impacting that community. And so it's not we are reporting, for example, on our dashboard by deaths, we now report who was associated with a long-term care facility, either as a patient or a provider. But at this point, the numbers are the numbers, and it is definitely spreading throughout the community. And that's what's killing people. That's the reality.
All right, we have another question. I believe this is for Dr. Joseph. Can you explain what is pool testing, and is that a method for increasing the number of people being tested in order to shorten the response time?
Yes. Pooled testing would be taking a swab from 12 different people and putting all 12 swabs into a liquid medium and running one test. And if that test is negative, then all 12 persons are negative. So you can shorten the turnaround time, shorten the testing time. If that test is positive, then each test has to be done individually to find out why it was positive. To do this, the FDA has approved this, but each test system has to be validated so that it works. And it is a very promising way to facilitate testing more quickly.
Great. Another question, could teachers wear PPE like other frontline workers so we can get kids back in the classroom?
And I will address that. We are still being very conservative with the PPE. We don't want to have a shortage of it when we're trending upward in a surge. I think certainly that can be considered, but I think there are far more important considerations. But right now, there is a concern of the capacity as we move in this direction to have sufficient PPE. Right now, we do check with all of our hospitals, and they do all have a 30-day supply. But it's a lot of concern about issuing PPE to those who are not directly in contact with patients.
Steve, I have kind of a follow-up question for Dr. Joseph and maybe a little bit for Supervisor Andersen. Quest and others have mentioned, Dr. Joseph, that they're reaching an our capacity for testing. Is that going to be a hard ceiling for a while? And what are the implications if we're limited to how many we can test and that the bottleneck is at the test sites? What does that mean to us long-term?
Well, it has to improve. The only answer is we cannot be limited by capacity to test. We need to ramp up the capacity, ramp up the ability to do more testing. That's the only answer. I have spoken with people at LabCorp at both sites, at Phoenix and in North Carolina. They want to do it. They are working as hard as they can. Their suppliers are manufacturing reagents as much as they can. So everybody wants the same thing, but right now it is the bottleneck.
What can public policymakers do to help that better for you and for that industry?
I defer that. I don't know what public policymakers can do to improve capacity for testing.
And I can tell you for our county labs, excuse me, I have grandchildren nearby you're hearing. Their mother is in labor in the hospital right now. Thus, I have children next to me.
Candace, life is real. It's okay.
Life is real. So you will hear some little chatter of grandchildren. And my husband was going into a deposition. He had them until now. But that being said, we have been purchasing more equipment for our county labs. Challenge is still things like reagents and things that we don't have control over. So it slows us down in processing the tests. But we are continuing to look at every possible lab out there besides the traditional ones, and meet Kylie, who's showing up in the background. And so it's a challenge, but we're taking it as one of the most serious challenges, but also looking at, things like the pooling is a great option to try to get more testing done. It's also looking at some of the newer saliva quick turnaround tests that don't require a commercial lab processing them. All those things are just so promising, but this is such a novel virus that we're dealing with, and we've never encountered in our lifetimes anything like this, but we wholeheartedly agree. Testing and the tracing are critical. But in the interim, we can slow down its spread if people will follow those simple steps. And I will go to the point that Dr. Joseph was talking about. We're not finding through our contact tracing that someone is casually picking up COVID because they were at Costco wearing a mask. It's from family gatherings, from graduation gatherings, from celebrating. Those are the more common reasons that we are finding through our tracers that it is being spread. And so it still requires a great deal of vigilance. Yes, we all wish it was over. We wish we could just go back to our normal lives. But the more people will follow some real simple steps of masking, try not to socialize, we're going to get there that sooner.
And Dr. Joseph, would you also let those folks in the private industries who are trying to ramp up the testing in these extraordinary times, how appreciative we are of the things they're doing to help us stay safe? Let them know we appreciate. They aren't always recognized because they're behind the scenes, but we appreciate the things they're doing in private industry to ramp things up for us. So tell them thank you for us.
Thank you. I'd be happy to. I talk with them frequently.
Thank you, sir. Steve.
All right, I believe we have time for one more, and this is also another grouped question. So if COVID is found in a classroom, why can't you just shut it down for one night and do a deep cleaning? They've read that UV light now kills COVID within 5 minutes. So could you open up schools, and if you find COVID, just do a deep cleaning overnight and have the students return the next day?
Yeah, that's the easy answer. It's not the facility, it's the people. And how are you then in that classroom? You're gonna test the teacher, you're gonna test the students, and then you've got to see who else they've been impacted. Yeah, I think we're finding we can deal with surfaces, and we do that pretty well. And hospitals have been doing it, businesses have been doing it. It's more the people than the facility. And I think, as Dr. Joseph pointed out, if you're outdoors, you're that much better because you're less likely in an open area to have a transmission than a confined indoor area.
if I can add, as we were looking at different hybrid type opportunities and schedules, one of the things we were considering was different cohorts. So smaller groups of students rather than trying to have a full class as we might have in the past. One of the things we looked at from a scheduling perspective was, Monday, Tuesday for one cohort, Thursday, Friday for another cohort, with deep cleaning on Wednesday and over the weekend. So as you move in and out of different cohorts of bubbles, you would make sure that you clean before the next cohort would come in to hopefully help to minimize the impact on surfaces that may have gotten infected at some point, and really being able to really focus in on that grouping that may have some issue. Well, I have an opportunity. Let me just mention one other thing for folks who are listening. I really appreciated Dr. Joseph's input in all of the various factors. One of the things he mentioned was, the possibility, particularly for younger kids, of, the spread only being about 3 feet. As we were looking at hybrid type of possibilities, we were looking from the direction we're getting from county health of not 6 feet, but 4 to 6 feet distance for our classrooms. And we did a lot of work physically looking at our classrooms to see how many desks we can fit in appropriately, how many students can really participate in a classroom setting safely. And even at 4 feet, we were starting to see some real problems in terms of that initial expectation of trying to go back 5 days a week. Since then, the direction that we're getting from the state is back to 6 feet. I believe it was only our district and one up in Marin County that looked at the possibility of at least starting out at a 4-foot distance. And they had already decided to go distance learning. So at this point in time, we're looking at 6 feet. Clearly, we'll be looking at different types of options in our transition plans. But as much as we may want to get it down to as few distance as possible, at 3-foot distance, logistically right now, we have to look at 6 feet and see how that would work out.
I'd like to also say thank you, Dr. Joseph. There will be a number, we don't know how many, but there'll be quite a few parents setting up small little schools in their homes as kids try to have these little pods to learn why the distance learning is going on. And your last slide and your thoughts about it, sort of protocols they should seriously think about putting in place is really, really helpful, because there isn't anybody out there giving parents direct feedback on how to set up a safe learning environment. And I thought what you outlined was at least a baseline that parents can look at. This program will be available, and your presentation will be available on YouTube through all the hard work that Steve does. And I think that if parents look carefully at that and do a little bit of homework, they can put in place those minimum stuff. And that's really, really helpful. The ideal thing is, I remember in college, we'd have seminars out in the quad area or in the commons under the trees, doing philosophy lessons. And that essentially is the safest environment. If we could have classrooms where kids are in the shade, outdoors, gentle breeze, 3 feet apart, that appears to be a fairly safe environment. But I think what I'm also hearing is you have one positive case show up and it changes the whole dynamic again. So again, Dr. Joseph, thank you so much for your hard work. We appreciate you being here every week. Ken, it's been a difficult few weeks for the entire school board and staff. And again, it's a chance to say thank you. There are a lot of people who may disagree with decisions a school board may have made along the way. But I got to say, in good faith, nobody works harder than the 5 of you. And you all went into it trying to create the best decisions for children. And we all appreciate what you guys go through and what you did, reading hundreds upon hundreds of emails, tremendous amount of pressure from points of view being tossed your direction. And we elected the 5 of you to help steer us through this. And we are appreciative of everything the 5 of you have done. So thank you, Ken.
Thank you, Bill.
Candace, I can repeat those same words to what you're going through. You've got a fine staff working for you, and I want to say thank you to each of the 4 of them because they carry a heavy load for you. I think it's important we recognize them, including Gail, your chief of staff, and the hard work that she does. Thank you so much. Steve, as always, thank you for quarterbacking this. We will not meet again for 2 weeks. We're not sure what we'll talk about in 2 weeks. The world seems to change rather quickly. And so 2 weeks from today, we will have other guests. We will talk about COVID and its impact upon our community. If Dr. Joseph is again available in 2 weeks, we'd love to have you again to address really any subject you want to or what's ever happening. My fear is that very quickly one of the national networks is going to steal Dr. Joseph away from us and try to utilize his talents. As long as we can keep him local, we appreciate that. So I wish everybody a wonderful and safe weekend and have a great day. Thank you.